Good morning, good afternoon, and good evening. Hey guys, welcome back to the channel. My name is Omer and I'm a doctor. My aim is to bring you knowledge which can improve and sometimes even save lives. In today's video, we'll be discussing what bronchiectasis is, its causes, symptoms, and treatments. We'll also be covering how bronchiectasis affects your body, when to see a doctor, some important lifestyle changes and preventative measures to keep in mind if you have bronchiectasis, and the possible complications of the condition. So let's get into it. What is bronchiectasis? Bronchiectasis is a chronic respiratory condition characterized by permanent widening and scarring of the airways in the lungs. This can cause a buildup of mucus, which can lead to recurrent infections, persistent coughing, and difficulty breathing. Bronchiectasis can affect people of all ages, but it is more common in older adults and those with underlying lung conditions. It can be caused by a variety of factors, including genetic mutations, lung infections, and autoimmune diseases. The condition is chronic and requires ongoing management to prevent complications and improve quality of life. Causes of bronchiectasis. Bronchiectasis can have a variety of causes, including infections. Infections such as pneumonia, tuberculosis, and whooping cough can cause damage to the bronchial tubes, leading to bronchiectasis. Cystic fibrosis. Cystic fibrosis is a genetic disorder that affects the lungs, causing thick mucus to build up and clog the airways, leading to infections and damage. Immunodeficiency disorders. Disorders that weaken the immune system, such as HIV, can increase the risk of developing bronchiectasis. Inhaling foreign objects or chemicals. Inhaling foreign objects or chemicals can cause irritation and damage to the bronchial tubes, leading to bronchiectasis. Gastroesophageal reflux disease can cause stomach acid to flow back into the esophagus and reach the lungs, leading to inflammation and damage. How bronchiectasis affects your body. Bronchiectasis affects your body in several ways. As the bronchial tubes become damaged and widened, they are less able to effectively clear mucus and other debris from your lungs. This can lead to an accumulation of bacteria and other pathogens, which can cause infections and inflammation. Over time, this can lead to scarring and damage to the lung tissue, making it harder to breathe and increasing the risk of complications such as respiratory failure. Symptoms of bronchiectasis. The symptoms of bronchiectasis can vary from person to person, but some common ones include persistent cough that produces mucus. This is often the first symptom of bronchiectasis and may worsen over time. Shortness of breath. This can be due to the damaged airways being less able to move air in and out of the lungs. Wheezing or chest tightness. This is due to the narrowing of the airways caused by inflammation and damage. Fatigue. This can be caused by the increased effort required to breathe. Recurring chest infections. This can be due to the buildup of mucus and bacteria in the lungs. Clubbing of the fingers or toes. This is a rare but specific symptom where the tips of the fingers and toes become wider and rounder due to chronic lack of oxygen in the body. When to see a doctor. If you have bronchiectasis, it's important to stay vigilant about changes in your symptoms and seek medical attention if needed. Here are some key signs that may indicate the need to see a doctor. Changes in your cough. If your cough becomes more frequent, severe, or produces more mucus than usual, this could be a sign of a respiratory infection or exacerbation of your bronchiectasis. Shortness of breath. If you experience increased difficulty breathing or feel like you can't catch your breath, this may be a sign of a worsening of your bronchiectasis or a complication such as pneumonia or pneumothorax. Pneumothorax is when air leaks from your lungs into your chest cavity. This is a medical emergency, so you need to seek immediate medical advice. Fever. If you develop a fever, this may be a sign of an infection, and you should contact your doctor right away. Worsening symptoms. If you notice that your symptoms are getting worse over time, even if they're not severe, it's important to check in with your doctor to discuss potential treatment options. Diagnosis of bronchiectasis. Diagnosis of bronchiectasis typically involves a combination of medical history, physical examination, and tests such as chest X-ray, CT scan, sputum culture, and pulmonary function tests. In some cases, a bronchoscopy may be performed to examine the airways directly and obtain a tissue sample for analysis. Treatment of bronchiectasis. The treatment of bronchiectasis aims to manage symptoms, prevent complications, and improve quality of life. This may involve a combination of medications, airway clearance techniques, pulmonary rehabilitation, and lifestyle changes. Lifestyle changes. Lifestyle changes such as quitting smoking, avoiding exposure to lung irritants, and getting vaccinated against respiratory infections can help to prevent infections and reduce symptoms. Airway clearance techniques. These techniques, such as chest physiotherapy and postural drainage, help to loosen and remove mucus from the lungs, reducing the risk of infections. Pulmonary rehabilitation. This involves a combination of exercise, breathing techniques, and education to help improve lung function and quality of life. Medications. Bronchodilators and inhaled steroids may also be prescribed to reduce inflammation and open the airways and help with breathing. Antibiotics may be prescribed to treat infections and prevent future ones. Typically, a longer course of antibiotics for 2 weeks is required during an acute infection. Complications of bronchiectasis. Bronchiectasis can lead to several complications, including pneumonia. Bronchiectasis increases the risk of developing pneumonia, which can cause serious complications, especially in older adults or people with weakened immune systems. It is important to make sure your vaccinations are up to date, for example, flu, pneumonia, and COVID vaccinations in order to help prevent these infections and reduce your chances of complications. Lung abscess. This is a collection of pus within the lung tissue that can occur as a result of a severe infection. Pulmonary hypertension. This occurs when there is high blood pressure in the blood vessels that supply the lungs. This affects the function of the heart, leading to symptoms such as shortness of breath and fatigue. Respiratory or heart failure. This may occur in severe cases when the lungs are unable to provide enough oxygen to the body, leading to symptoms such as shortness of breath, rapid breathing, and confusion. Conclusion. In conclusion, bronchiectasis is a chronic respiratory condition that can cause serious complications if left untreated. It's important to see a doctor if you're experiencing symptoms such as persistent coughing, shortness of breath, or chest infections. While some causes of bronchiectasis are beyond our control, there are several preventative measures we can take to reduce our risk of developing the condition, such as quitting smoking, practicing good hygiene, and getting vaccinated. Remember, if you have bronchiectasis, it's important to work closely with your healthcare team to manage your symptoms and prevent complications. With the right treatment and lifestyle changes, many people with bronchiectasis are able to live full and active lives. And that's it, guys. I tried to make bronchiectasis super simple for you. My wish is that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.